So as I mentioned, Deirdre is another student from UL. She is a student of the Bachelor of Science in Mental Health Nursing. And Deirdre's title for her presentation is The Impact of the Utilisation of Telehealth on Primary Mental Health Care Service Delivery. So I'm going to hand over to you, Deirdre. Oh, and I can see your screen popping up there as well. So handing over to you, Deirdre. Thank you.
Hi, how are you? Thanks for having me today. Can you see those slides? Are you okay?
We can indeed. Yes, we can see them.
Hi, as I said, my name is Deirdre O'Brien and I'm a fourth-year mental health student in UL. I've also conducted a focus mapping review and synthesis, similar to my two colleagues that just did their presentation before me. And the aim of my research was to ascertain how the utilisation of telehealth impacts upon primary mental health care practice. And just a background to put into context what telehealth is. Telehealth would include video telephone connections between healthcare providers and clients or patients. This can be video conferencing, email, smartphone, other telecommunication technologies that are employed to diagnose and treat mental health illnesses. Because of COVID-19, we saw in the country, we had a rapid transition to telehealth care which was compliant with the World Health Organization infection prevention and control strategies. So Mohammed in 2021 his research suggests that there was a 4,347% increase into the utilization of video conferencing in the delivery of mental health care practice. So there's the rationale. Again, I just think that this warrants investigation. This rapid transition warrants investigation, and what kind of implications it may or may not have in practice was what I was trying to ascertain. The methodology of this research is interpretivism. It's the provider's point of view, or it's the provider's experience, how they experienced delivering telehealth in their practice. So it comes from the epistemological theories of how we gain knowledge from the world. What experience did the healthcare providers have when trying to implement telehealth practice? So that's the methodology. Again, it's a focus mapping review as the two girls had, and I did mine from January 2021 to September, so it was a 9-month time frame that I had stipulated. I did that. I deviated from the 6-month time frame because I needed to broaden my scope of articles. So again, I started my focus review by generating a PO research question. So my population that I was interested in targeting was primary mental health care providers, and their experience was utilization of telehealth, whether it be video conferencing or whatever. And the outcome was the implications on primary mental health care practice. So to source journals that were relevant to this topic, I utilised the UL Gluckman Library resource. So I just keyed in mental health care. This generated journals, relevant journals for me to investigate. So this is just a sample of 3 searches I did. So 3 searches brought up 17 journals. I brought up 18, but there was a duplication. So these journals then were identified as reliable, objective and relevant research that I could further investigate to try and ascertain my question. So the 5 journals I eventually picked, they were high-ranking quality journals that were reputable, objective and relevant to the review question. Once I had identified these journals, I then did a journal search. I again used the UL library, and I researched their impact factor, their readership, their publication, who reads these journals, what caliber of research was I basing my research on, was what I was trying to ascertain here. So in those 5 journals and in my time frame, I identified approximately 1,200 articles published within that time frame. So to slim down the articles, obviously I couldn't, investigate 1,200 articles myself. I did an inclusion and exclusion criteria. So I based my research on primary research. I didn't want any symptomatic reviews. So the journals identified had to be, published within a date, open access articles. This open access also addresses the point of confidentiality and consent, and that these were open access that were out there. Mixed method studies, qualitative studies, quantitative studies, case studies, and pilot studies were included in my criteria. I excluded journals outside the time date, systematic reviews. Systematic reviews were excluded due to the fact that data extraction can be extremely difficult from these. So, and dissertations, brief reports, and editorials, grey literature were excluded. So, to refine down my 12 articles, I used Scopus, and using keywords and truncations, I refined articles that would be relevant to my research question. So there's just an example of it, of how I had used mental health. If you see in the first example, I use not inpatient. Community mental health care, primary mental health care is community mental health care. I didn't want papers that were going to diversify into inpatient care. So this is just an example of how you can slimline your search, and this is what I did there. So this is the piece de resistance. This is the mapping, finding, and implication for practice and recommendations that I mapped and synthesized from my research. I had picked 5 articles. The articles varied. They try to encompass mental health provision. Mental health provision can be one-on-one or group initiated. It can be types of therapies that are employed to address mental health issues can vary depending on the diagnosis. A person with anxiety or depression will not have the same treatment pathway as a person with schizophrenia. So I picked a range of 5 articles to try and include a varied practice delivery. So some of my articles include telehealth challenges for primary mental health care physicians, patients and providers' experiences of video conferencing, educational interventions employed to educate nurses to expand their knowledge, self-efficacy and usage of telehealth. Social distancing of people with DBT. DBT is normally a group initiative. It's a very specialized initiative, and it can be very a complex initiative, even one-on-one. Even though they do use telephone in it, to go to complete telehealth, it can cause problems in administering the intervention. And so then I used challenges and prerequisites for these. So my findings identified 3 issues that needed to be addressed: staff training, service development, and organizational development. These were the themes that were mapped out in the 5 articles that I had chosen. And the recommendations for the staff training was education and supervision and coaching on telehealth administration. Communication over telehealth is very different to communication face-to-face. So training in communication skills was also recommended. And you see 5 of these articles would have recommended all 3 of those recommendations. Group intervention facilitation training over Microsoft Teams or Zoom or whatever was also recommended. So that was a universal, staff training was a universal theme identified through the research. Service development as in a blended model of healthcare provision. This can, in practice, this is shown if somebody is given mental health provision. Some local policies have a stipulation that a client can only have 3 telehealth visits. The 4th one then has to be face-to-face. These kind of stipulations and all that try and ascertain or maintain a high quality service delivery. So also what was identified was shorter and more frequent patient contact. You don't necessarily have to have your hour visit that would be, the traditional visit. Maybe 10, 15-minute visits more frequently might be of more benefit to the patient. Also, outcome measurements embedded in the program delivery. It was recognized that you have to monitor the outcomes of this transition. So these have to be embedded in the programs. And monitoring technology and barriers of human relationships. We're now going to be reliant on technology. We need to be able to monitor how technology is performing for our delivery of service. So these service development recommendations were identified. So then we have an organisational development, policy, procedure, protocol and guideline development was recognised. Network-orientated models of mental health care. Some countries that have different models of mental health care, they have open disclosure, or open dialogue, I beg your pardon. It's a Finnish model of mental health care where they take acute mental health care and try and implement it in the community. Again, it's a complex system, and it's not, the infrastructure of it is different to what we practice at the moment, but this is seen as the way forward. So organisational development has to be online with facilitating the development of mental health care delivery. The network-orientated models of mental health care would be the open dialogue mental health care again. And another thing that was identified in 3 of the papers was we have to foster a positive organisational culture to this telehealth transition. This is, you know, because of COVID and COVID-19 and that, our practice has changed. And we as professionals have to take that on board and with a positive attitude, live up to the challenges of implementing this new modality of mental health care provision and, you know, take a positive slant on it rather than being negative. So that's what my mapping and recommendations literally were. And the limitations was the research was not discipline specific, even though I'm a nurse. I had to do psychology and occupational therapists and other kind of mental health care providers research as well, just to be more inclusive in my research. But it was governed by the NMBI ethical guidelines. I would like to thank my my module leader, Trace Hennessy, and my tutorial lecturer, Ruth Ryan, as well, for their assistance in that. And here's my references. So if that's okay, I'll just, any questions? Thank you.
Thank you, Deirdre. Thank you very much. I think we have 1 or 2 minutes for a couple of questions. I know we are due to go on a coffee break between now and 2 p.m, but we might use 2 or 3 minutes for questions for either Deirdre, Ivan or Kira, if anyone has any questions in the audience. And I might just pause recording there to see just before we take any questions.